Hi, I'm Sophia. Slowly but surely, my pregnancy journey is coming to an end. Today, I'm having my last pregnancy-related health visit, my 6 weeks postpartum visit at OceanMed with Dr. Stone.
Well, good morning, Sophia.
Hi, Dr. Stone.
How are you feeling today?
I'm feeling fantastic. Thanks for asking. We're slowly but surely settling into a routine at home.
Wonderful.
Dr. Stone, I have a couple of questions, though, with regards to the postpartum stage. Is that okay?
Sure, please ask.
Can you tell me a little bit what stages does the body go through in the postpartum period?
Well, that's an excellent question. There's many stages that the body goes through, both physiologic, but also we have to think of the mental side of how our bodies go through changes when a woman has a baby. At first, we have that immediate postpartum phase in the first 24 hours. A woman's body goes through these tremendous changes where their body's plasma volume, their body's blood pressure, their body's volume of blood goes through a tremendous change of where it has to now accommodate for one person when it used to accommodate for two. And so we see that in the immediate postpartum phase within the first 24 hours. It's actually amazing to think that somebody goes from, say, a cardiac output, which is the amount of blood that's pumped in 1 minute, for 5 liters, it actually drops down to about 3.5 liters. So it has to go through these adjustments rather quickly. So that's one we call of the immediate phase. Of course, the big part of the immediate phase is stopping the bleeding. And it's amazing that the body can do that by simply having the uterus contract down and close off those vessels that otherwise were supplying that wonderful rich supply to our child. Once that immediate phase comes through and the woman has shown themselves to recover well from that point, now we get into the first week. And in the first week is really not just the physical phase where the breasts are now starting to be prepared for making the milk and actually now releasing milk. First starting off as a very concentrated colostrum and then becoming the more mature milk release. There's also the cramping that's happening and the uterus getting smaller. Have you felt that?
A little bit, yeah.
Yes, and you might even notice that the body has a sense of cramping that's coinciding with breastfeeding or even with the baby crying. And that has to do with the body's wonderful connections neurologically to both the breasts and the uterus, as well as hormones that are being used to promote the milk letdown for breastfeeding and also for making the uterus contract. The principal hormone is oxytocin. Many people have heard of Pitocin. Same thing. The other part then is just dealing with the gradual change in how the swelling happens in the person's legs. Now, Sophia, you may have recognized that when you were in the hospital, the swelling might have actually seemed more so then than it was when you were pregnant.
Definitely.
And the reason for that is the body's trying to figure out where that fluid, that extra fluid that it had been carrying for the pregnancy, where does it go? It eventually finds out that it needs to get to the kidneys and out to the bladder and out. And so you probably noticed how much you were going to the bathroom and urinating. And that's a natural part of the physiologic process. That happens in the first week. Now, also note during this time, you're going to have some bloody discharge. It's not going to look like frank blood all the time, although sometimes it might. Small amounts. It should be about the consistency of a period, maybe less. This is called lochia, L-O-C-H-I-A. And this is a natural discharge that is released. It signals the changes happening inside the uterus as it's beginning to pull away the debris that's left behind from having a child. And that's regardless of whether you've had a vaginal delivery or a cesarean delivery. So you're going to see that happening in that first week. And in fact, that component can last for weeks, sometimes even months. When breastfeeding, it's interesting though, most women will see it shortened relative to women who don't breastfeed. And we think it has to do with that, again, connection and signaling that allows the uterus to stay nice and tight and therefore contracting down stops some of the bleeding and bloody discharge that could otherwise occur. But that brings us to another spot, and that's about how do you feel here, not just here. So let me ask you, have you been noticing any changes for you about how you feel inside?
I would say by week 2, I was having a lot of ups and downs, emotional ups and downs, occasionally crying without a reason and just feeling very down, very sleep deprived, and then also feeling very, very happy. But it actually has subsided, which brings me to the point I heard that postnatal depression is quite common, is quite prevalent. What are the signs to really look out for in comparison to what they call the baby blues?
So what you're referring to is an area where many women find themselves, which is after the baby's been born, there's been this tremendous celebration of the baby finally getting here. You've completed the journey, and then the journey begins. And that feeling can sometimes be sort of a crescendo and decrescendo of emotions, and it can happen within just minutes after delivery, and it can linger for hours, days, and sometimes weeks and months. So baby blues is something that we expect many women, and arguably most women, particularly first-time moms, might experience. It's a tremendous change and tremendous responsibility to care for an individual, a baby. And it's something that no one can say they have an understanding of until they actually are doing it. And besides the sleep deprivation, it's just the constant wanting to be always attentive to the child and physically not being able to do that. That really creates that paradigm where a person feels maybe depressed or anxious or worried. So often we talk about the depression side of it, but we don't talk about the anxiety of it. And actually data has shown us that there's more tendency towards anxiety than even depression in these areas. Even with the sleep deprivation making you tired, it also makes you anxious. So in the first week, a woman will go through those changes, but we call it baby blues if after a week's time, 7 to 10 days, the woman feels as though they have sort of mastered and conquered that feeling and can go on and function reasonably well, despite still having to wake up and take care of a child. Now, postpartum depression or postpartum anxiety, those terms usually come out when we're talking about women who aren't doing such a great job of being able to deal and conquer and master those feelings and emotions. That's where we can come in. That's where I, as a doctor or any healthcare provider taking care of that woman, can come in. The most important thing is to recognize is to ask. If it's even in simply a call to the house or just a discussion back and forth from the follow-up visit in 1 to 2 weeks from either a C-section or a natural delivery, and finding out how that person's feeling. If they're feeling tearful, if they're not feeling they're in control of things, they don't feel well, that's where we can work together. And either through me doing some behavioral modification and conversation, or through even sometimes, if necessary, medication that can be given, that can be safe, by the way, while you breastfeed and care for your child. There are opportunities for us to help in patients who have either postpartum anxiety or postpartum depression. The key things here are to pick up and be honest with the doctor. So when you're telling me, I don't feel so well, I may be more probative and say, have you had any thoughts of hurting yourself? Or have you had any thoughts of hurting anyone else, including maybe the child? This may seem a bit upfront, but it really is important to ask those questions because doing that makes us know what level that person is at. Sometimes if they're feeling those sensations of, or thoughts or ideologies of wanting to hurt themselves or hurt others, that's something that needs more serious and immediate attention, and sometimes even hospitalization. And certainly the idea that we can work as a team. I will reach out to sometimes a psychologist or psychiatrist to help in the situation. If a patient has had a history of psychiatric history of depression or anxiety, then that's something that's important to have known through the pregnancy, of course, and know that once the baby's born, it doesn't miraculously cure and go away. So that's another factor that we will put in as far as patients who need that special attention and special addressing of their condition.
Definitely feel well cared for. Thank you so much.
Thank you.